Hello everyone, I'm Dr. Jong from Lih-Ren Clinic. Many Oriental women don't like thick calves. They think thin calves are not beautiful. Compared with divided breast augmentation, liposuction, calf reduction surgery is a field that most of breast surgeons are not familiar with. I have been performing calf reduction surgery for more than 20 years. I made 2 videos. Part 1 introduced the cause of thick calves. Because the main cause of thick calves is calf muscle hypertrophy. In Part 2, I will introduce the treatment of calf muscle hypertrophy. I hope that everybody will have a basic understanding of calf reduction surgery after seeing these videos. Women, especially Oriental women, don't like thick calves. There are 2 reasons. The first reason is that if the legs are thick, the leg look shorter and the people look shorter. The second reason is that if the legs are thick, they look stronger and muscular. Girls with thick calves don't like to show their legs because they think their legs are not good looking. They don't like to wear short skirts. Generally speaking, there are 3 causes of thick calves. The first is edema, the second is fat, and the third is muscle. How do you know that there is edema in the calf? The easiest way is measure and compare the leg circumferences at the same location in the morning and at night. If the sizes are different, it means that there is edema. Take this lady as an example. On the left is a photo of her legs in the afternoon, and on the right is a photo of her leg in the morning. It can be clearly seen that the area around the ankle is larger in the afternoon, and the curve of Achilles tendon is hard to see. The difference of leg circumference is about 1 centimeter. One of the causes of her thick leg is edema. In addition to congenital calf edema, people who often standing or sit for a long time and have no movements of her leg are prone to edema. The easiest way to improve edema is to wear calf compression stocking and move the leg once in a while. Then talk about fat. In consultation, I often heard that, "Doctor, look, my fat is so thick." She pinched in this way. She pinched both fat and muscle together. The correct way to assess fat thickness is to standing and tighten the muscle and then pinch the skin in this way. The thickness between the thumb and the index finger divided by 2 is the thickness of 1 layer of fat. If the thickness of fat is greater than 1 centimeter, liposuction should be considered to thin the subcutaneous fat and improve the shape of the calf. The locations where the subcutaneous fat is thicker are usually on the outer side of the calves and around the Achilles tendons. Another location is on the inner side of the knee. The third reason for thick calves is muscle. There are several possible causes of calf muscle hypertrophy. The first is congenital. Many patients say that the leg of other people in her family are also very thick. The second is exercise. It is understandable that people who run a lot must have a stronger calf muscle. The third is people who had poliomyelitis when they were young. Healthy leg is thick because healthy leg take more roll when walking, just like the leg of the lady in the picture. In fact, the main reason of thick calves in Asians is calf muscle hypertrophy, so that calf reduction often requires treatment of the calf muscle. The muscle related with thick leg is gastrocnemius and soleus. The gastrocnemius muscle is located in the superficial layer behind the calf, divided into 2 parts, medial and lateral. You can easily see the curve of the medial gastrocnemius by standing on your toe. The inner calf curves is mainly determined by the medial gastrocnemius. The lateral gastrocnemius is relatively smaller and less visible. The gastrocnemius muscle spans the knee joint and its role is to bend the knee and the tiptoe. The soleus muscle is a muscle located deep to gastrocnemius muscle. The tendon is shared with the gastrocnemius is the Achilles tendon. Its function is to tiptoe. The lateral curve of the calf is mainly determined by the soleus muscle. The posterior curve of the calf is determined by the medial and the lateral gastrocnemius. In summary, the cause of thick calves including edema, fat, and muscle. But in fact, cause of thick calves maybe are a mixture of the above three. Among them, the main causes are calf muscle hypertrophy. The main treated leg muscle are medial gastrocnemius, lateral gastrocnemius, and the deep soleus muscle on the back of the calf. I will introduce how to treat calf muscle in the next video. Thank you for watching.